Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
Hi. Now we're going to look at Chapter 2. Now, as you can see, it's not easy to determine what behaviors meet the criteria of psychological disorders and which do not. For example, one psychiatrist's definition of psychological impairment might be very different from another. So to standardize the diagnostic process, the American Psychiatric Association, that's the same folks who brought you the APA formatting, has created a manual of mental disorders, the DSM-5. The 5 indicates the 5th edition, and the first edition, just so you're aware, was in 1952. And we're going to look at a variety of methods of assessment and, we're going to look at a variety of methods of assessment that clinicians use to arrive at a diagnosis. A good assessment will classify, gather comprehensive information regarding personality and cognition. All information gathered will help recommend the best treatment and set the course in the right direction to help this person along. So let's begin. We're going to start with the interview because each diagnosis begins with an interview, and each interview can vary based on the clinician and the reason for the assessment. Interviews can include topics such as identifying the demographic data, description of the presenting problem or problems, psychological history, medical psychiatric history, medical problems and medications. The interview can come in 3 forms. It can come either as a structured, which is or standardized, semi-structured, or unstructured. The most widely used method of assessment, the clinical interview, involves the use of a set of questions designed to elicit relevant information from people seeking treatment. Clinicians usually use the structured interview, which consists of a fairly standard series of questions to gather a wide range of information concerning presenting problems and complaints, present circumstances, and history. First, a face-to-face setting allows a client to describe their presenting complaints in their own words. Second, the clinician may observe a variety of nonverbal behaviors which also provide clues into the client's personality and problems. And third, the interview may orient the interview to a person rather than vice versa. At the same time, a major disadvantage of the interview is that the data may be distorted by the particular questions asked, as well as the interviewer's personal and cultural bias. Now, in the interview, there will be the use of both open and closed questions. Open questions require the respondent to answer in a descriptive manner, in their own words, if you will. How have your moods been lately is an open question because it asks them to describe how their moods have been. Closed questions basically require a yes/no response. Have you had any periods of crying or tearfulness in the last 2 weeks? Yes or no. So they'll try to have a mix, but largely a lot of open questions. Now, psychological tests are administered. Intelligence, personality tests are structured and standardized tests over a large number of people, creating norms. So when they say standardized, they really just mean that this test has been given to a lot of people. So there is a certain amount of consistency around the delivery and what the questions mean. And creating norms just mean that you deliver them in a very specific manner so that no one gets an unfair advantage, as it were. Psychological tests also measure relative stable traits of intelligence and personality, must be reliable and valid, and I'll revisit those terms a little bit later. These tests can then provide some insight into what is normal and abnormal. Now, intelligent tests help clarify issues of abnormal behavior. Tests of intelligence, like the Stanford Binet IQ score for intelligence, and the Wechsler scale, multiple scores on aspects of intelligence, are used for various purposes in clinical assessments, including determining evidence of intellectual delays or cognitive impairments, and assessing strengths and weaknesses. Intelligence is expressed in this form of an intelligence IQ. Now, they do these testing of IQ to differentiate those issues that can be related to lower intelligence and those issues that aren't related to intelligence at all. If intelligence is normal and these other issues are occurring, then it's not to do with intelligence. Now, there's two types of formal tests to assess personality. There are self-reports or subjective tests, personality inventories like the MMPI or the Minnesota Multiphasic Personality Inventory, or use structured items to measure various personality traits such as anxiety, depression, and masculinity and femininity. These tests are considered objective in the sense that they make use of limited range of possible responses to items and empirical objectives, methods of test construction. So they really aim to standardize, again, the questions such that the answers can be more easily more reliably measured. The second type of tests are known as projective personality tests. The Rorschach, the TAT. The TAT is the Thematic Appreciation Test, Apperception Test, and that asks the subjects to interpret ambiguous stimuli in the belief that their answers may shed light on the unconscious process. These tests, as well, tend to project your own objectives, needs, and desires onto the presented stimuli. Now, a practitioner may ask for the response on a TAT card or some ambiguous scene in a magazine involving one or more people. So you would see this image and you would be asked to say, so what's going on? And so then when the picture is displayed, I might ask the participant to write a paragraph or so in response to the following questions. What are the people in this picture doing? What are they saying to each other? And how do you think this situation will turn out? Then ask participants to share their responses, and you'll usually find that responses can vary considerably from one person to another, illustrating how each of us tends to project our own motives and feelings into the figure shown. You might point out that this is the common theme in a person's response to a series of pictures that provide important clues to his or her personality, not simply the response to the given picture. So you're sort of reading between the lines, if you will, as a clinician. Now, next are some methods of neuropsychological assessment to help determine organic base for impaired behavior and psychological functioning. The MRI, the magnetic resonance imaging, and CT, computerized tomography, can determine both if the brain is damaged and where it is damaged. Now, the Luria, Nebraska test battery, it's based on Alexander Luria, his work, is a sophisticated battery of tests measuring various perceptual, intellectual, and motor skills and performance, testing for brain function and malfunction without surgery. Now, a departure from that is more of a behavioral assessment, where test response are taken as samples of behavior rather than as signs of underlying traits or disposition. The behavioral examiner may conduct a functional assessment which relates to problem behavior to its antecedents and consequences. Methods of behavioral assessment include behavioral interviewing, self-monitoring, use of analog or contrived measures, direct observation, and behavioral rating scales. Now, focuses on the objective recording and/or description of behavior will use a functional analysis, the ABC model, if you will, and that is A for antecedent or situation, B for what is seen and heard, the behavior, and C, the consequence or reinforcers. Involves direct observation or behavioral interview. Now, the use of self-monitoring, where a person would record or in some way monitor of their own behavior, like a diary, can be very accurate of what is happening, when it's happening, under what circumstances are things happening. Now these need to be baselined. The level of behavior before the treatment in order to compare after the treatment. So if you're doing a baseline, let's say you're going to provide me with some treatment. So let's first have me record in a diary for a week, provide the treatment, and have me record in my diary during the treatment for us to be able to compare when I don't have treatment, when I do have treatment. Now another method is analog measures. These can include role playing, where the client can practice a strategy. Some phobias can use stages or levels of approaches of what one fears. Behavioral rating scales are checklists providing data about frequency, intensity, and range of problem behavior. Another type of assessment would be a cognitive assessment. Focuses on the measurement of thought, belief, and attitudes in order to help identify disordered thinking problems, putting people at higher risk for developing emotional problems. The aim is to identify distorted thinking, very much a cognitive approach, and replace it with self-enhancing rational thought patterns. Specific methods of assessment include the use of a thought record or a diary, and the use of rating scales such as the automatic thought questionnaire, the ATQ30 is the example of that. Now another measure that can be gathered, another measures that can be gathered is that of psychological function, including heart rate, blood pressure, galvanic skin response, the GSR, muscle tension, brain wave activity, electroencephalograph, the EEG measures brain waves, and the electromyograph, EMG, measures muscle tension. So there's a lot of measurement tools. In addition, you can be using some brain probing using brain imaging techniques such as EEG, CAT scans, PET scans, MRI, fMRI, beam, and MEG probes in inner workings and the structures of the brain. We're getting very high tech in the way that we're able to observe the brain's functions to see where things are working functionally well and where they're having difficulties. Okay, what we've done is a quick overview on that component. I'm going to do a part 2 that looks at some of the treatment options by theory. All right, so let's get into part 2 in a moment.